Greetings to our future nurses. This nurse licensure mock exam covers meconium and transitional stool patterns, management of chronic diseases in primary care, adrenal gland disorders, Addison's disease, Cushing syndrome, beta blockers in anxiety management, and lastly, mandatory reporting of abuse and neglect. Without further ado, let's start. Here is your first question. A nurse in a family clinic suspects a child is a victim of neglect based on assessment findings. What is the nurse's primary legal and ethical responsibility in this situation? A. Confront the parents immediately to confirm the suspicion. B. Document the findings but maintain strict client confidentiality. C. Wait for more concrete evidence before taking any action. Or D. Report the reasonable suspicion to the proper authorities. The correct answer is letter D. Report the reasonable suspicion to the proper authorities. Next question. A psychiatric nurse is explaining medication options to a client with significant performance anxiety. How do beta blockers primarily help manage this type of anxiety? A. They lessen the physical symptoms, like a rapid heart rate and trembling. B. They alter thought patterns to reduce psychological worry. C. They block the euphoric effects to reduce addiction potential. Or D. They increase serotonin levels to improve mood. The correct answer is letter A. They lessen the physical symptoms, like a rapid heart rate and trembling. Next question. A patient is admitted with suspected Cushing syndrome. Which cluster of assessment findings would the nurse most likely expect to document? A. Hypoglycemia, fatigue, and salt craving. B. Hypotension, hyperpigmentation, and weight loss. C. Moon face, central obesity, and hypertension. Or D. Hyponatremia, hyperkalemia, and dehydration. The correct answer is letter C. Moon face, central obesity, and hypertension. Next question. In a community health center, a nurse is conducting a health class for patients with hypertension. Which primary care strategy is most effective for the long-term management of this chronic disease? A. Scheduling appointments only when the patient feels symptomatic. B. Providing one-time education during the initial diagnosis. C. Focusing solely on pharmacological interventions as prescribed. Or D. Empowering patients with knowledge and skills for self-management. The correct answer is letter D. Empowering patients with knowledge and skills for self-management. Next question. A new mother is concerned about her newborn's stool. Which finding, if observed, would the nurse correctly identify as a normal transitional stool? A. A dark greenish-black, sticky, and tar-like stool. B. A greenish-brown to yellowish-brown, semi-formed stool, less sticky than meconium. C. A pale yellow, soft, and seedy stool, typical of a breastfed infant. Or D. A watery, green stool, occurring more than 8 times a day. The correct answer is letter B. A greenish-brown to yellowish-brown, semi-formed stool, less sticky than meconium. You made it through a challenging set. What's your score? Download our free AI app Reviewers today, and see the difference.